بسم الله الرحمن الرحيم.
Beginning by the name of Allah, who is the most merciful and kind. This is a Smart tool from British Institute. This channel is based on knowledge. You are kindly requested to like, share and subscribe our channel. Thank you.
Dear viewers, today we are going to discuss about headache. Definition. Types of headaches. Are headaches hereditary? What causes headaches? What causes migraines? What triggers headaches and migraines? What do headaches feel like? What headache symptoms require immediate medical care? How are headaches evaluated and diagnosed? How are headaches treated? How can I prevent headaches? So let's start.
Headaches are a typical condition that the vast majority will encounter ordinarily during their lives. The primary symptom of a headache is a pain in your head or face. This can be pulsating, steady, sharp or dull. Headaches can be treated with prescription, stress management and biofeedback.
How common are headaches in adults? If your head is throbbing, you're not alone. Headache is one among the 4 most common pain conditions within the world. Up to 75% of adults worldwide have had a headache within the past year. Headaches are a serious explanation for absenteeism from work and faculty. They also take a toll on social and family life. For a few people, continually battling headaches can cause feeling anxious and depressed.
What are the types of headaches? There are more than 150 types of headache. They fall into 2 main categories, primary and secondary headaches. Primary headaches. Primary headaches are those that aren't due to another medical condition. The category includes cluster headaches, migraine, new daily persistent headaches, NDPH, tension headaches, secondary headaches. Secondary headaches are related to another medical condition, such as disease of blood vessels in the brain, head injury, high blood pressure, hypertension, infection, medication overuse, sinus congestion, trauma, tumor.
Are headaches hereditary? Headaches tend to run in families, particularly migraines. Kids who have headaches normally have in any event one parent who additionally experiences them. Truth be told, kids whose guardians have migraines are up to multiple times bound to foster them as well. Headaches can likewise be set off by ecological components partook in A's family, for example, eating certain foods or ingredients, like caffeine, alcohol, fermented foods, chocolate and cheese, exposure to allergens, second-hand smoke, strong odors from household chemicals or perfumes.
What causes headaches? Headache pain results from signals connecting among the mind, veins and encompassing nerves. During a headache, an obscure component actuates explicit nerves that influence muscles and veins. These nerves send pain signals to the brain.
What causes migraines? Migraines aren't completely perceived. In any case, specialists think migraines result when precarious nerve cells overcompensate to different components, triggers. The nerve cells convey motivations to veins and cause compound changes in the mind. The result is disabling pain.
What triggers headaches and migraines? Common triggers of tension headaches or migraines include alcohol use, changes in eating or sleeping patterns, depression, emotional stress related to family and friends, work or school, excessive medication use, eye, neck or back strain caused by poor posture, lighting, noise, weather changes.
How are headaches treated? Quite possibly the most pivotal part of treating headaches is sorting out your triggers. Realizing what those are, ordinarily by keeping a headache log, can decrease the quantity of headache you have. When you know your triggers, your medical care supplier can tailor therapy to you. For instance, you may get headache when you're tense or stressed. Directing and stress the executive strategies can help you handle this trigger better. By bringing down your feeling of anxiety, you can stay away from stress-instigated headaches. Only 1 out of every odd headache requires drug. A scope of medicines is accessible. Contingent upon your headache type, recurrence and cause, treatment choices include biofeedback. Biofeedback instructs you to perceive when pressure is working in your body. You figure out how your body reacts to unpleasant circumstances and approaches to settle it down. During biofeedback, senses are associated with your body. They screen your compulsory actual reactions to headaches, which remember increments for breathing rate, pulse, heart rate, temperature, muscle tension, brain activity. Medications. Incidental tension headaches ordinarily react well to over-the-counter pain relievers. Yet, know that utilizing these drugs over and over again can prompt a drawn-out everyday headache. For continuous or serious headaches, your supplier may suggest solution headache meds. Triptans and different kinds of medications can stop a migraine attack. You take them at the primary indications of an approaching headache. Drugs for high blood pressure, seizures and depression can sometimes prevent migraines. Your healthcare provider may recommend trying one of these medications to reduce headache frequency.
How can I prevent headaches? The key to preventing headaches is sorting out what triggers them. Triggers are quite certain to every individual. What gives you a headache may not be an issue for other people. When you decide your triggers, you can stay away from or limit them. For instance, you may track down that solid fragrances set you off. Staying away from aromas and scented items can have a major effect in the number of headaches you have. The equivalent goes for other regular triggers like inconvenient food varieties, absence of rest and helpless stance. Numerous individuals, in any case, can't stay away from triggers or can't recognize triggers. All things considered, a more customized multidisciplinary approach with a headache expert is regularly essential.
Can headaches or migraines be cured? Treating medical issues that cause headaches, for example, hypertension, can dispose of head pain. As of late, there have been a few new headways in our comprehension of what causes headaches. In spite of the fact that we are nearer than at any other time to a fix, as of now there is no remedy for essential cerebral pains. Treatment centers around calming side effects and forestalling future scenes.
We hope that you have learned a lot from this video. If yes, kindly like, share, and subscribe with comment. Do not forget pressing the bell icon so that you get notification of coming videos. Thank you and Allah Hafiz.